Psychosocial changes, part 1. As you look through all of this big long list here, all of these areas will affect the psychosocial well-being of the aging adult. Retirement is a major role change and can cause a lot of stress. Family members, we look at, are they active in the older adult's life? And is the older adult still able to get out and participate in activities? There's a large number of psychosocial concerns in the older adults, and we need to be familiar with as many as possible. Aging does not equate itself with being confused. Cognition is both a biological and psychological factor. It is a process of acquiring, storing, sharing, and using information. Components of cognition include language, thought process, memory, execution of function, judgment, attention, and perception. Function of cognition includes attention span, concentration, intelligence, judgment, learning ability, memory, orientation, perception, problem solving, psychomotor ability, reaction time, and social intactness. A decreased brain size and weight are not consistent with deteriorating mental function. Cognitive functions can remain stable or they may decline with age. Education and financial status have an overall effect on protecting a person from cognitive impairment. We do have improved treatments for strokes, heart disease, and vascular conditions, and these also help protect from cognitive impairment. Mental skills can decline years before dying. Many men and women will undergo an accelerated drop in key mental skills as early as 15 years prior to death, but yet they can remain free of dementia. We look at it as use it or lose it type skills. We also look at intelligence, with fluid intelligence being native intelligence. These are skills that are biologically determined and are independent of experience or learning. For example, inductive reasoning or abstract thinking. And then we have crystallized intelligence, which is the knowledge and abilities of a person that is attained through education and life experiences. You can teach an old dog new tricks. It just might take a longer time. They do have an ability to acquire new skills, but this begins to decline the most after age 70. But they can still learn. To learn late in life, information must be relevant and must relate to what the person already knows. Memory is the ability to retain or store information and retrieve it when needed. There are 3 different types of memory. We have immediate recall, which is the last 5 to 30 seconds. Short-term, which is 1 hour to several days. And long-term memory, which is what has occurred in the lifetime. Familiarity, previous learning, and life experiences can compensate for memory loss. Health literacy is the ability to obtain, process, and understand basic health information and services so that person can then make appropriate decisions regarding health care. It requires the ability to interpret and understand prescriptions, appointment slips, medical education brochures, provider instructions, and consent forms, as well as to be able to interact with health professionals. Age-associated memory impairment. Age-associated decline in memory that does not meet the criteria for dementia is the definition, and it is considered to be normal. Cognitive impairment are disturbances in memory, orientation, and concentration. The 3 Ds of cognitive impairment are dementia, delirium, and depression. Mild cognitive impairment is memory impairment that is more than what is considered part of the normal aging process, but other areas of cognitive functioning are still intact. 50% of people diagnosed with mild cognitive impairment will go ahead and develop dementia within 3 years. Delirium are disturbances in consciousness and attention, memory deficits, delusional thoughts, and behaviors. It can be caused by medications, procedures, severe illness, sensory impairment, restraints, etc. The client may be in an environment that has unfamiliar surrounding. Psychosocial factors can be emotional distress or pain. The incidence is as high as 65% following an orthopedic surgery. So it is not uncommon to see an older adult experience delirium after an orthopedic procedure, but this usually is reversible and it will return to normal. We do see a rapid onset with it, and sedatives or analgesics may help reduce the incidence or duration of delirium. Dementia has a gradual and slow onset. It's irreversible and it causes memory impairment and a loss of intellectual abilities that are severe enough to interfere with daily life. It is the most disabling and burdensome of older adult chronic conditions. Different types of dementia include Alzheimer's disease, which consists of 50%. This is a progressive disorder that's caused by pathological conditions of the brain. It is the most common form of dementia and is the third most expensive medical condition. Another type of dementia is the Lewy body dementia, which consists of 15 to 25% of dementia cases. We see visual and auditory hallucinations and motor features of Parkinson's with LBD. The frontotemporal dementia consists of about 15% of dementia cases, and this is the early age onset or before 60 years of age dementia. We see poor hygiene, decreased social tact, hyperorality. In other words, they have no inhibitions when it comes to saying what's on their mind, sexual disinhibitions, repetitive behaviors such as pacing, clapping, singing, picking objects up, etc. Vascular dementia is at 10% of the dementia cases. It's also called multi-infarct dementia. We see an interruption of blood supply to an area of the brain, and behavior will vary with the area of the brain that is affected. Parkinson disease dementia can occur at least 1 year after the onset of Parkinson's. And Creutzfeldt-Jakob disease is very rare. It will show us failing memory, behavioral changes, lack of coordination, and visual disturbances. And then depression. It's very common in later life, and it can be life-threatening if it's left unrecognized and untreated. Interventions for these 3 Ds of cognitive impairment include accurate diagnosis, because the treatment and prognosis will vary with each area. With Alzheimer's, we see a lot of pharmacological type treatments, but we also realize that there is no cure for Alzheimer's disease. Clinical features of dementia are going to include apraxia, which is a disorder of the brain and nervous system in which a person is unable to perform tasks or movements when they're asked, even though the request or the command has been understood. Agnosia is a rare disorder that is characterized by an inability to recognize and identify objects or persons. People with agnosia may have difficulty recognizing the geometric features of an object or a face, or they may be able to perceive the geometric features but do not know what the object is used for or whether the face is familiar or not. And labile, which is a pathological emotional expression generally due to neurological degeneration or other complications, and it may or may not be mood congruent. In other words, the client might sob uncontrollably in only a moderately sad situation, or he or she might also cry when upset or angry. Nerve cells can regenerate in the area of the brain where memory function occurs. Different things that can help would be stress reduction, prevention and management of chronic conditions, a healthy weight, avoiding excess caloric intake, limiting sodium and fat intake, increasing antioxidant intake, physical activity, participation in mentally stimulating activities, and social engagement. All of these can help improve nerve cell regeneration. Mental health is the same later in life as it is earlier in life, but the challenges may be greater. We see mental health disorders such as anxiety disorders. Excuse me. Anxiety is a normal human reaction, and it's part of the fear response. It may be presenting symptoms of depression. Symptoms can include agitation, irritability, pacing, crying, and repetitive verbalizations. Anxiety disorders include a generalized anxiety disorder, phobic disorders, obsessive-compulsive disorders, panic disorders, and post-traumatic stress disorders. The next disorder we look at is paranoid symptoms. These can signify an acute change in mental status as a result of medical illness or delirium, or it can be an early symptom of Alzheimer's. With this, we see delusions, which are beliefs that are inconsistent with reality, and we also see hallucinations, which are sensory perceptions of a non-existent object. And schizophrenia is part of the paranoid disorder, which causes significant social and/or occupational dysfunction and is characterized by 2 or more of the paranoid symptoms. We also see bipolar disorder. We also see suicide. Rates are higher in older adults than any other population group, with the largest group being over 85 years of age. Older adults will rarely threaten suicide. They just do it. So we must take every hint of suicide very, very seriously in the older adult. And substance abuse is the other disorder. Cocaine and heroin are becoming more common in the older adult. Men are 4 times as likely to abuse alcohol, but women are more vulnerable to the effects of alcohol. Prescription medications and over-the-counter medications can also be misused. Coping patterns and the ability to adapt to stress develop over the lifespan and will remain consistent in later life. If a person was successful in dealing with stress in their younger adulthood, with development of self-image, etc., the skill will usually remain solid through old age. Adaptability, decision-making, and responding predictably is determined by past experiences. So what are some common stressors of old age? Excuse me. can be normal aging changes that impair physical function, impair activities, impair appearances, or disabilities from injury or chronic disease. Inheritance conflicts, abandonment, the fear of dying alone or not being found or a painful death, hospitalization, institutionalization, separation from personal physician, sensory changes such as vision and hearing, housing and home maintenance, limited mobility and lack of transportation, functional impairment, social losses such as loss of a driver's license, acute and chronic pain, loss of family, friends, and or pets, relocation, loss of personal belongings, expenses, and caregiving. We need to be familiar with how stress and stressors affect the human body, and this doesn't change just because we are aging. Spirituality is an important component of healthy aging. Spirituality is defined as the awareness of one's inner self and a sense of connection to a higher being, nature, or to some purpose greater than oneself. The quality of the person resulting from faith, a search for meaning, connection to others, and transcendence itself can all be deep, deep resources for healing. Spiritual needs are much broader than a person's adherence to religious beliefs. We have to be respectful of beliefs and not impose our own beliefs on our clients. Spirituality usually becomes more important as people age. Nursing research shows that spirituality is a source of hope. It aids in adapting to illness and has a positive influence on the quality of life in chronically ill older adults. Nursing research also shows that spirituality is a source of hope, aiding in adapting to... Never mind, I just went through that one. Spiritual well-being is considered the ability to experience and integrate meaning and purpose in life through connectedness with self, others, art, music, literature, nature, or a power greater than oneself. Physical health, loss of a loved one, and understanding that his or her life may be coming to an end usually will cause a reflection of the client's life. The Joint Commission requires spiritual assessments in all of our clients. The nurse must consider his or her own spiritual values and life meaning when caring for the spiritual aspect of our clients. By taking care of his or her own spiritual needs, the nurse is going to be better able to meet the spiritual needs of the client.